Basically, 100 years ago, almost to the date, not only did what we would call orthodox medical schools get all this money and rose to the top, not because of skill and benefit to their patients, just because of money. They also legislated themselves into being a protected monopoly. They're the only legal monopoly in America is the medical school. MD medicine. They're the only legal monopoly in America. Everybody else is a quack. Just ask them. By legislation, they legislated all their competition, all their legitimate competition, into being fifth-class citizens. Insurance doesn't pay for quacks and fifth-class citizens. They only pay MDs. When you look at the military, you look at the government, they only recognize MDs. So we have this huge problem because the skills that one MD has are similar to the skills that another one has. There's not much difference between them. And so it doesn't matter if they're a nice guy and they go to church. That's meaningless because they all use the same medicine. They all use the same procedures. So there's no options. And that's why we're in trouble. Okay? Now remember, we already all agreed, or at least 70% of us agreed, that our kids are in trouble. Because if you think we're in trouble, our kids are 1,000 times more trouble than we are. The age group that has the fastest growing rate of MS, multiple sclerosis, are kids under the age of 12. They're now diagnosing MS in kids under the age of 2, 16 months, 18 months. Historically, it was a disease of 35 to 50-year-olds, middle-aged people. What's going on here? Well, this is free radical damage to the myelin, the insulation material in the brain. And after school, Grandma takes the 6-year-old or the 10-year-old to one of these fast food places and gets them a shake. It's not a milkshake, it's made out of oil. It's, you know, one of these soft serve shakes. It's oil, free radical damage. It oxidizes, turns into trans fatty acids, and screws up their brains. So now Grandma is the one who's inflicting, out of ignorance, she's inflicting MS on these little kids because of free radical damage to their brains. Here's a NASCAR driver. He and his 3 brothers and sisters all have MS. It's not genetic. But his mother made sure they all had salads and put olive oil in everything. Olive oil, coconut oil, trans fatty acids, free radicals, bam, you have MS. The whole family's got it because Mama insisted they eat salads and make sure they put lots of vinegar and oil on their salads. But my doctor said that was healthy. Well, your doctor only lives to be 56. Why would you believe him? And when it comes to stroke, the age group that has the fastest growing rate of stroke in the United States are kids under the age of 18. Stroke is not genetic. Stroke doesn't just happen. It's not the bad God on Mars creating stroke because you didn't burn enough goats to him. The reason why people have strokes is a simple deficiency or a ratio problem between omega-3s, 6s, and 9s. How many of you supplement your 2-year-olds with omega-3s? I don't see any hands going up. 1, maybe. It's your responsibility because doctors know nothing about nutrition. Nothing. You're better off asking a hobo under the bridge who's dumpster diving behind McDonald's when it comes to nutrition. Because he'll live longer than the doctor. As crazy as that sounds, they live longer than the doctor. Now, the fastest growing disease today in the industrialized world in kids is rickets. It's a physician-caused disease. Let's see, stay out of the sun, get skin cancer, put on SPF 7 billion sunblocker, long sleeves, gloves, big brim hats, shades. Don't go out after 9 in the morning. You stay inside until after dark. Stay inside doing your twittering and texting and making, you know, all your computer stuff. Don't you eat egg yolks because you can get cholesterol damage your heart. That's where you find vitamin D3 naturally. Don't you take vitamins and minerals because you can overdose. This is a physician-caused disease. It's a perfect storm. Everything doctors have told you about nutrition is the cause right now of every industrialized nation. The worst possible nutritional deficiency disease in kids is rickets. Rickets! In the 21st century. Because doctors know nothing about nutrition. Now, I want to talk briefly about birth defects. I'm going to take off my jacket because it's warming up in here. There's about 500 birth defects, congenital events. None of them are caused by genetics. There's not a single birth defect that's caused by genetic transmission, not a single one. We've learned this in the animal industry. We can prevent every birth defect you can name and 10 times that many you can by giving perfect preconception nutrition to the females. In humans, we wait until they've missed a period or two. You know, I might be pregnant, go and get checked out. Yeah, here's some prenatal vitamins. Well, 6 weeks has already gone by. That embryo has been at risk for 6 weeks. Somebody needs to go to jail, and it's usually the OBGYN, because there's no consequences to a failed pregnancy. What if every time an OBGYN was in charge of a lady's health, female problems, and he says, okay, I'm going to be in charge of your pregnancies, and there's a baby born with a defect, there should be a penalty for him. Throw a few in jail, hang a few, guess what? I guarantee there wouldn't be any more birth defects after that. But now there's no consequences, so they don't care.